My name is Keith Knabb. I'm the founder and principal of Affordable Medicare Solutions. We are the premier, we are the largest Medicare planning agency in Georgia by far, and we also are the most award-winning. We have lots of awards we've won, and we are very prideful about that. And awards are sometimes awarded about good customer service, and that's what we pride ourselves on, is very high customer service. It's not just me. I have myself and 8 employees that help people year-round with any of their problems, any of their questions, any of their needs. If they're moving, if they have a health crisis, anything that they need, we'll connect them also with other Medicare resources or other aging resources, such as finding a good assisted living home, or if you need home health care and other services, just let my office know and we can point you in the right direction. I'm going to share my screen right now and we'll get started. And it says on this screen, the beginner's guide to Medicare, but don't worry, if you've already been in Medicare for a long time, this is basically the story of Medicare. It's what happened to Medicare and where it's been and where it's going. And we'll talk about that in great detail. And you're going to like this. I think it's a good story to tell. But I have to tell you right off the bat, this is for educational purposes only. I don't actually work for Medicare. I work for you. I do this as a public service. And you can go to the Medicare website. Never, ever go to Medicare.com. Go to Medicare.gov, which is the government website. And you get all sorts of great information there. And I use that every day in my business. We're not going to talk about any plan names. We're not going to talk about companies or prices today. This isn't about selling you something. This is about telling you the story of Medicare. We have a bunch of additional education flyers available at my website, which explains these topics, as well as a booklet, a 10-page booklet that covers all of this also, to make it very quick and easy instead of reading the 150-page Medicare and You guide. So here's the story. The Medicare got started in 1965. The problem was that seniors didn't have health care at retirement. So the government said, we're going to create some programs. We're going to create 2 right off the bat: Medicare for regular seniors, and then Medicaid for low income, poor, indigent seniors. And Medicare and Medicaid are not the same as group health insurance. They're not the same as veterans benefits, of course, and they're not the same as the Affordable Care Act. This is really important. You can have Medicare with your employer insurance while you're still working. If you're 66, 67 years old, you can have Medicare with veterans benefits. You can have Medicare with Medicaid, but you cannot have an Affordable Care Act Obamacare plan the same time that you have Medicare. That's not allowed. And back in the 1960s, they said, well, who's going to be eligible for this program? Well, the first thing they said was, we're looking at how old people are living. About that time, it was about 65 or 66 years old was the life expectancy. So they said, we'll create this program as a safety net, and we'll make it available when people turn 65. And they thought people would be on this program for a year, 2 or 3 years on average. Of course, people are living a lot longer today. So people are on this program for 15, 20, or even 30 years or more. And it's a great safety net. But in the middle of all that, some people raised their hands and said, well, wait a minute. Joe got hurt. He's working at the factory and Joe got hurt and he's only 57 years old. How is he going to get health insurance? So the government created item number 2, type 2, is Social Security disability income, to pay Joe a check to keep him from being homeless, to pay him a check to give him some money. And if he's been on that income program for at least 24 months, they then give him Medicare. It's automatically assigned to him. Now, during those first 24 months, we use the Affordable Care Act to give Joe some insurance right now. That's been very helpful. But after 24 months, his Medicare kicks in, and that's what we convert him to. Then some other people raised their hands and said, well, wait a minute. We got somebody that's got kidney failure, end-stage renal disease, or Lou Gehrig's disease, which is called ALS. They're not going to live 2 years. So the Medicare now starts right away, maybe as early as 4 months into their treatments, so that they can get Medicare and stay healthy or get better or maintain their health or get life-saving treatments pretty quickly. And there's going to be some new categories that are being added to those. They're debating those right now. Probably 4 or 5 more categories are going to be eligible for accelerated Medicare enrollment. So this is what makes Medicare different. It was designed in the 1960s. And there's a foundation of Medicare. And in the 1960s, everything was done at the hospital. The hospital is where you would go for testing. And we'd go to the hospital for, exploratory surgery, or you'd go to the hospital for observation. And so Medicare made the hospital portion called Part A for free. There's no charge. They thought that's what everybody needed. Well, today, 50 years later, more than half of Medicare spending is outpatient. That's Part B of Medicare. That is saying, I need to go get an MRI. I need to look inside my body. I don't want to go have exploratory surgery. I want to know what's wrong with me. I want to have testing done. You go to your doctor's office. You do all these outpatient things. Hip replacement surgery is outpatient. It's incredible. You can get your knee and hip replaced on an outpatient basis. So outpatient Part B of Medicare this year was $144 per month. Next year, it's $148.50. Now, there's a small deductible under Part B. This year was $198, and they raised it $5 to $203. Very, very good coverage. And that's your foundation of Medicare. When you start with Medicare, you say, I need Part A and Part B. Now, if you're working at a large employer, you might only start Part A for a while. But when you leave your employment, you're going to need Part A and Part B in order to get the rest of Medicare started. And I'll show you what that means. In 2005, the Medicare Modernization Act, that was actually passed in 2003. The Medicare Modernization Act started improving Medicare in 2005. And it was designed to make Medicare more versatile and not so old and antique. They wanted to give seniors options. Pay attention to that word option. They're not forcing people to make changes. They never did. They made everything optional, gave people choices. And Medicare is doing this over 20 years, from 2005 till 2025. But if you compare that to the Affordable Care Act, where there's been all sorts of problems, that was done almost overnight from 2010 and then 2013 and 15, just an absolute mess. So this is a good example of one side of the government getting it correct, and yet right next door on the other side of the Health and Human Services, they got it wrong. And so this is something that the new president might try to fix, is to help the Affordable Care Act to be more successful like Medicare. We'll find out. Who knows what's going to happen, but Medicare has been very stable. I get a lot of calls from seniors. They say, I read in the newspaper that my hospital is not going to be covered on my plan next year. That's not Medicare. That's under the Affordable Care Act. So don't be tricked by misinformation. So let's still stay in the 1960s and 70s. Back in the 1960s and 70s, when Medicare was first starting, people started complaining. It was a new program. There were some problems. There were some holes in it, some gaps in it. And insurance companies love to hear about little tiny problems like that. They can sell people little miniature insurance policies that'll fix those problems. And insurance companies started going crazy, hog wild, creating a million different little plans to help Medicare. And the government saw that this was a problem in the 1980s, and they said, this is crazy. Everything's going sort of, haywire. Let's standardize. This is the first time that health insurance was standardized nationwide. And it was made so that Medicare supplements became called Medigap plans. Those are little tiny supplemental plans to Medicare, and they standardized them, and they made a big mistake. Government makes mistakes, of course. They started naming these new Medicare supplements with letter codes, A, B, C, D, E, F, G. And they had already started with Medicare with A and B on hospital and outpatient. They should have done something different, maybe Roman numerals or something else. So this made it a little bit confusing, and that was a mistake. But those supplement plans are very popular and very, very effective. Half of my clients use them. But think about this. You have your first card, which is your Medicare Part A and Part B card. Then you get your second card, which is your Medicare or Medigap supplement card. And then you get now, after 2005, you get a drug card. So we call this a 3-card system. You got to carry 3 cards in your pockets because you got to show your pharmacist one card, you got to show your doctor and hospital a couple of other cards. So this is important. It was designed over many, many years. This happened, and this is the way that it occurred. So let's talk about what the government's done to kind of change that. Half of people have chosen the traditional side of Medicare. So when Medicare decided to upgrade and change and modernize in 2005, they said, let's make a one card system, a single ID card, just like you have when you're working at your employer. You have one card, no big deal. And they said, we're going to put Part A of Medicare in this card. You're still going to have to pay for your Part B, which is 148. We're going to build into this. Most all of these plans include the drug coverage, and we're going to give you some extra coverage. If you've seen Joe Namath on TV lately with his big toothy smile, he says, don't miss out on your extra Medicare benefits. This is what he's talking about. He's talking about these new Medicare Advantage plans. And these are actually called Part C of Medicare, another letter to help you confuse things. But this is where you see HMOs and PPOs. HMO means a mandatory network, very restrictive network, and PPO means optional network. It means you can go where you want. You can go in the network or outside the network, and those are more flexible. So this Advantage programs are have about 25 or 26 million people. But I want to show you in my practice, and this is what Medicare has seen also. I've seen this for 8 or 9 years. Half of people choose traditional Medicare, and half of the people at age 65 are choosing the new side of Medicare. It's literally balanced 50-50. Medicare reports this also. There's no right or wrong. I'll tell you how to make a decision on what is right for you. Don't have somebody tell you that one side is better than the other side. That's not true. And this is how you make the decision. I have some spouses choose traditional Medicare, and another spouse will choose modern Medicare, even in one household. So this is how you make decisions. If you like Clark Howard, like I do, he's a great consumer reporter, very, very well-spoken in a very plain language. He talks about things in simple language so you don't overthink things. So let's talk about this Medicare traditional versus the modern side. And if you see on my screen, it says SUP for supplements and ADV for Advantage plans. But the first column says, what doctor can I use? The second column is, how much is this going to cost me each month out of my pocket? And the third column is, what is this going to cost me when I get sick to get better? So if you look at the first column, it says, if you're on a supplement, you can go to any doctor nationwide who is willing to see you that accepts Medicare. Remember, not all doctors are taking new patients. And if you go to the next column, it says these supplements are more expensive and you need to buy a separate prescription plan. You're going to spend $150 to $200 per month to get your Medicare coverage, besides the $148.50 you have to pay anyway. But here's what's great. When you go to the hospital, it's free. When you go to the skilled nursing center, it's free. When you get your cancer treatments, they're nearly free. That's 100% coverage when you do get sick. So some people want that peace of mind. And if you look at the Advantage section at the bottom of the screen, if you want to go to a doctor, you first want to look at their network. You're going to get a better deal in the network. If you choose an open access PPO plan, you can also go out of network, usually with very little penalty or hardly any difference. And you can go to any doctor nationwide that is, again, willing to see you. And these Advantage plans are very interesting because 85% of them have a zero premium, zero cost per month. And people say, how in the world could they have a zero premium? Medicare funds these programs at about $950 per month. You're not going to have 100% coverage. You're going to have copays, $5, let's say, to the regular doctor, maybe $40 to the specialist, maybe $90 at the emergency room. Maybe an MRI is going to cost you $200. You're going to pay copays as you go along, and you're going to be protected so that you don't have $10,000 of bills. You're going to be protected with an out-of-pocket maximum rule, anywhere from about $4,000 to $8,000 per plan, depending on the coverage. No deductibles, just a risk that if you did get really sick, it could add up a little bit. So really, if you're going to go even simpler than that, if you look on the left-hand side, it says prepay, whoops, or pay as you go. Pay as you go. So you can either prepay for your medical care by buying an insurance policy, paying an insurance company to cover your bills, or you don't pay an insurance company, you pay zero premium, and you pay when you need care as you go along. It's that simple. There's no rocket science here. Your grandmother taught you that. You can either pay now or pay later. There's no such thing as a free lunch. Very, very straightforward. Now, before you get excited about any program, you want to make sure it's a quality program, and Medicare has a quality system. It's called the star rating. 5 stars is fantastic, 1 star is horrible. So it goes from 1 to 5 stars, and these are ranked every year. And this year we got them early. We got them in October. Normally we get them in November. So you actually have the star ratings for all the plans as we're shopping this year during the annual enrollment, which is right now from October 15th to December 7th is the annual enrollment. And we actually get to see which plans are the highest rated plans. Very good news this year. The government is very efficient this year. And the star rating tells you, is it a bad plan or a good plan? 5-star means excellent. We rarely get that. We have a 5-star plan this year. A very restrictive HMO is 5 stars, but most of the plans are at about 3.5 to 4.5 stars. Most plans fall in that range, about 75 or 80%. And we have very few plans that will end up being 1 or 2 stars. If they're a low-rated plan, somebody's getting fired. Those plans get a deduction. Instead of getting $950 a month, they're going to get less money. And the 5-star plans get a big bonus. And the 3- and 4-star plans get a small bonus. So it's very important for these major insurance companies with large pools of clients to get those bonuses, and they work very hard for them. Now, the most pressing issue in America for seniors, besides COVID, besides the election that just was finished, is prescription drug pricing. We know this is a problem. Medicare, the new president is saying that that's one thing they're going to work on is drug pricing. The current president did a fantastic job lowering the cost of insulin drugs this year. Hopefully next year we'll see even more drugs come down in price. But it's been incredible. If you know anybody that's taking insulin, this is the best year ever for them, and we can help them out. Just call my office. It's amazing, some of the programs. But prescription drugs were not even covered by Medicare until 2005. Think about that. 15, 16 years ago, seniors had to pay for their drugs themselves out of their pocket. So the government tried to design a drug program. And of course, when the government designs something, it's going to have a bunch of competing interests. And they were very worried that this program that had never been created before was going to sink the federal budget. And they put a lot of weird rules into it. And it's kind of confusing. I'll make it simpler for you. But remember, there's a certain period in the drug benefit that's called the donut hole. It used to be a horrible boogeyman that people would walk away from the pharmacy counter because their drug coverage ended for a while. And so the government fixed that. From 2011 until 2019, the government fixed the donut hole, and now you only have to pay 25%. So I'll show you what that means. Look at this. Look how this is so discombobulated. You can have a $445 deductible on your drugs, or maybe not. If it's generic drugs, most plans don't charge a deductible for generics. Some plans do. You each get an initial coverage amount of $4,130. That's great. But then you have this thing called the donut hole. That's where your drugs, you'll have to pay 25% of the cost of your drug. If it's a $100 drug, you'll pay 25 bucks. But if all of a sudden you hit a risk of $6,550, the government steps in and says, we're going to help you. You've obviously got major problems. We're going to pay 95% of the cost of your drugs at that point. So they will kick in and pay 95%, and you'll pay 5%. If you have a $1,000 drug, it'll be 50 bucks. So it's a pretty good drug benefit, just kind of confusing. Low income people don't have to go through all of these rules. Low income people get to skip all of the rungs of this ladder and instead go right to the 95% coverage level. And 20% of seniors who are eligible for the low income subsidy have failed to apply or reapply for the program. You might have been turned down for it a couple years ago, but you might qualify today. Your spouse may have passed away. Your assets may have dwindled. You need to reapply for the low income subsidy. And then all of a sudden your drugs would only be 5% of the cost. Incredible stuff. Very, very cool. So here's the deal. How do you figure out what's the right drug plan for you? It's actually super simple today. The government over the last 2 years has fixed the Medicare website. They should have done it 10 years ago, but they did it over the last 2 years, where now it's super simple to choose your drug program. There's 32 drug plans per county. I know you're all excited to go look at 32 different types of tires or 32 different types of carpets. No, it's 32 drug plans, but you don't have to look at them all. Once you put in your drugs or check off your drugs, if you're already in Medicare, you just check off which ones you're taking. They're in your Medicare.gov account. You go to Medicare.gov, you create a login and password, and boom, your drugs are in there. And you can choose your pharmacy. You can choose a couple of pharmacies and compare them. But you push go and it tells you immediately what's the right plan to be on. You don't have to look at 32 plans. It'll tell you right away, here's the top plan for your pharmacy, for your drugs, and for your area. It's really simple. We do these in 15 or 20 minutes with our clients, do these drug reviews. And today I saved a client $1,000 next year on her drugs. It's very common to save $2,000 or $3,000 even on the drugs. But the average, Medicare says the average per person error when doing these drug reviews, which means all Medicare people are having problems with this, is $720 per year. That's $60 a month. And the way this happens is you'll be on a drug plan and you'll set it and forget it. And you'll be on there for 4 or 5 years and the insurance company loves it because you're not paying attention. And they raise the cost of your drugs, or they change your preferred pharmacy from Walgreens to CVS, and you don't read the letter they send you. And you're like, shoot, it kind of stinks. I go in January and my drugs used to be $20, now they're 40. You know, damn it, the drug costs are going through the roof. No, you're not using your plan properly. Or they raise your premium. It goes from $20 a month to $50 a month. And all of a sudden you're like, man, this stinks. I'm spending $60 a month extra. And you're stuck because you didn't do this drug review before December 7th. You're stuck for a whole year on the wrong plan. And every time you waste $720, you have lined the insurance company's pockets with an additional $720. So if they've got 20 million people on these plans, they love it. They love the extra money you are handing to them. Don't do it. Be a good consumer. And if you need help, just call my office and we'll help you with this. But it's not hard to do. There's extra help. I told you about low income subsidy. Social Security will pay up to $33 a month for low income people, so they get a free drug program. They will also, if the person is low enough income, will also lower the cost of their drugs at the pharmacy. So when you walk up to the pharmacy counter, you say, you know, my insulin is normally $200, and they'll say, nope, $9, $9.20 for your insulin. Maybe even only $3.70. And there's other help where they'll get rid of your deductible, they'll get rid of that hated donut hole, and they'll give you the coverage of the catastrophic level immediately. Depends on your income. You can qualify for all three or just one of these. If you're not low income and you do have a high cost medication, I have some very rich clients that are getting help with high cost medications through patient assistance programs. And so I have a client who has a drug that's $1,000 a month, and he's only paying about $25 a month for it. We've got a list of these patient assistance programs we can send to you. You have to apply. You have to request the assistance. We can't for you. And then if you've ever seen the commercials or the application for your phone, for your smartphone, you can download on your smartphone an application called GoodRx. It's very, very simple to use. And you just double check the prices of your drugs, because you might have a great drug program. I saw this today with a drug for the gentleman. It was a good price. It was $40 for his drug. And I went to GoodRx and it was $27. So he's going to use the coupon instead of using his Medicare plan for that one drug. His other 6 drugs, he's going to use his Medicare card. And don't let a pharmacist or a pharmacy tech tell you that you can't use both GoodRx and your Medicare card. You can. Totally legal. You just can't use them on the same drug at the same time. So if you get any blowback from your pharmacist, let my staff know and we can help you to fight that. Now here's modern innovations. I know we're having a fast pace today because I want to leave some time at the end for us to talk, answer some questions. But you may have seen Joe Namath on TV and he's talking about your extra Medicare benefits. Well, let's talk about what's been modernized over the last couple of years in Medicare. The current president did a lot of relaxation of the rules to tell the plans to offer more benefits for seniors to help them. And look at number one. Number one's not a big miracle. It's preventive care. I've had preventive care on every single plan I've ever had in my life. Well, Medicare back in 2010 decided to add Medicare in preventive care to Medicare in 2011. So that was a long time ago. But in 2005, they tested it first. They first tested it out in the Advantage plans and the HMO and PPO plans from 2005 till 2010, and then they rolled it out through the rest of Medicare. So that was done a long time ago, but there's still some doctors that think that Medicare doesn't cover preventive care. Now, it doesn't always cover everything that a doctor wants to do, but it covers most things. It's 27 items for both males and females that it covers, which is really good. But some doctors want to do 32 items, so there's other things that Medicare might not cover. But look at number two, gym memberships. Does Medicare pay for a gym? No, of course not. But Medicare now has relaxed the rules and allows the plans, if they want to spend some of their funding on a gym membership for you and give it to you for free, that's fine. And it's smart. They've tracked that people that go to the gym and do these exercise classes have a 30% reduction in medical spending. It's a no-brainer. And Medicare doesn't cover eyeglasses and routine eye exams, but it should, because half of all glaucoma is found in routine eye exams. Medicare doesn't cover hearing aids. Probably should, but it doesn't. Hearing aids are expensive, but hearing loss leads to brain shrinkage. Your brain actually gets smaller. And dental care. Medicare doesn't cover dental. Maybe it should at least cover some cleanings, because periodontal disease leads to other problems in your body. Lots of other problems. Untreated periodontal disease can lead to brain issues. And they're studying that. A lot of the new Medicare HMO and PPO options have a ton of dental, vision, hearing aids, and other benefits built in to give a total healthcare experience. Traditional Medicare doesn't do it yet, but they're talking about adding it at some point. Number three, there was supposed to be a lot of additional at-home services. We've seen a few at-home services, such as over-the-counter medical items, so that stuff that Medicare doesn't cover, like cough and cold syrup, or vitamins, or Q-tips, or toothbrush, or toothpaste. A lot of the new HMO and PPO plans are delivering those to your home for free. I have clients that have that benefit and have forgotten they can get this stuff for free. It's just there. You got to call and ask for it, but they forget. It's free stuff that you would fill your medicine cabinet. Some of the Medicare plans are also offering free transportation. Transportation services, not in an ambulance, but just a transportation ride to get you to the pharmacy or get you to your doctor. If you have a friend that normally takes you to the doctor, or a spouse, and they go in quarantine, who's going to take you to the therapist? You get a free transportation ride to the doctor. Adult daycare, some plans are actually paying for a respite care or for a person to come into the home to give the caregiver a break. If you're taking care of your spouse, maybe you need a break. About 1% of the plans are doing that. Very, very few. Usually those are low income plans. Number four, this is what's going to save Medicare. Number 1, 2, and 3 are pretty cool, but what's going to save Medicare is number 4. Medicare spending is 50% of all of Medicare spending is for 5% of people. So 5 people out of every 100 are spending half of Medicare's money. Same thing with Medicaid. And usually it's because somebody is chronically ill. They've got 2 or more medical conditions. They've got obesity and diabetes. They've got kidney problems and blood pressure problems. They have heart and lung problems, When people have 2 or more problems, their medical costs go through the roof. It's not the person that gets the new knee or the new hip or a new shoulder or has a few things happen to them. It's the chronically ill. So they've designed chronic illness management programs, and they're lasering down extra funding for those people. And we know those special needs programs, and we can help your friends and you with those, finding those extra benefits. And then many, many Medicare plans are using care coordination. Regular Medicare needs to do this. It's crazy that they don't. That's when you leave a hospital and a person tracks you to make sure you go get your rehabilitation care at the rehabilitation center or by going to a therapist, making sure that you're doing your cardiac therapy or your physical therapy, making sure that your oxygen was delivered to you, making sure that you followed up so that you don't go back into the hospital or don't get worse, that you actually get better. A care coordinator is a no-brainer. Medicare should have been doing it 20 years ago, and they're finally doing it today under the new programs. A lot of hospitals are employing care coordinators, and I train them. I teach them those care coordinators. That's a lot of stuff to go over. And then people say to me, well, Keith, well, how do I flat just get into Medicare? You know, I'm losing my job, or I'm retiring, and I want to get into Medicare. Well, let's talk about the ways you enroll in Medicare. The first one that everybody gets is when you turn 65. That's your initial period. It's a natural time. I'm turning 65. Please give me my Medicare. If you're receiving Social Security, they just automatically sign you up. But if you've not signed up for Social Security, you're delaying that to your 67 or later, then you need to actually go to the Social Security website, ssa.gov, and ask for your Medicare to start on your birthday month. It'll be the first day of the month you turn 65. Now, if you're still working, you might say, I only want to have the hospital portion of Medicare. So it'll help me with my work employer plan if you're at a large employer. If somebody is disabled, they also get this when they get awarded by the judge. When the judge awards them their disability status, they also get an initial enrollment. They might only be 30 years old if they have a motorcycle accident or something. They get their initial enrollment period upon the award. Now, everybody that's in Medicare goes to number 3, which is the annual election period. That's what we're in right now. The annual election period is from October 15th to December 7th. And that's when you can make changes to your Medicare HMO or PPO and your Medicare drug plan. Now, people that don't fall in the initial election or the annual election would be a special election, the one in the middle, special election. A special election means that you are not turning 65. Maybe you've been working and now you're 68 and you're like, I'm going to retire now. Or I'm already in Medicare and I'm going to move from Georgia to Florida or wherever. Or I had a spouse die and I've lost other coverage that was through my spouse. That's special elections. And that's where my staff really are superior. We know all of the rules and the dynamics and how to massage the rules so that when people have these sometimes crisis events, we can fix their Medicare. Oftentimes, we use a special election rule to fix the Medicare in the middle of the year. Now, the last category, number 4, the advantage election period, the number 4, started recently in 2019, so that people that are in the HMOs and PPO plans, the new side of Medicare, if they found out in January or February that their doctor wasn't in their network or their drugs not covered, they can not freak out anymore. They can say, I've got a problem. Can we fix it? Yes. January, February, March, we get a one-time mulligan to put them onto the right program for the whole year of 2021 or whatever. We didn't have that rule before. And so the new president, the current president, put that rule in back in 2018. It started in 2019 so that we could fix people's Medicare plans. And that has been really helpful so that people weren't unnecessarily penalized because their doctor dropped out of their network. Now, if you look at the bottom of the screen, it says these special needs plans for chronically ill people or low income people, they get to make a choice every single quarter, not just first quarter and not just the last quarter, but every single quarter I can fix their programs. So I help a lot of chronically ill people and low income people through the year managing their Medicare. So here's some mistakes. If you do these things wrong, and this happens all the time, I did my taxes for a while myself, and I did them wrong. And so I started hiring somebody to do my taxes because I did some boneheaded mistakes. Well, that's financial penalties. The lucky thing about taxes is you can go back and refile your previous taxes and amend them. You can't do that with Medicare. If you make a mistake, it might be a lifetime penalty. So if you take COBRA from your employer instead of taking Medicare, you're making a mistake. You probably need to take COBRA on your younger spouse. And if you're over 65, you go into Medicare and just do COBRA on the younger person. If you don't, you can really screw up and create a lifetime penalty under Part D for drugs and Part B for the outpatient care. Part B is a severe penalty. Part D is sort of a minor penalty, but it's still an irritant for the rest of your life. Low income people don't have to pay the penalties, so don't worry about that. If somebody's low income, the government is not going to penalize the poor. But high income people, ooh, they're a juicy target, and the government wants to penalize them. And so the government throws extra fees on purpose to anybody who has a household income of more than $174,000 per year. They want to soak the rich. That's their goal. And that's what they do. So I know you all feel like you're a Medicare expert. We've been into this for about 40 minutes, 35 or 40 minutes. And there is a 100 question test at the end. So get your pen and pencil ready. No, I'm just kidding. There's no test. We're going to talk about some more things about Medicare. Remember, it doesn't cover everything. If you want full true dental, you can buy dental insurance. If you have some dental coverage under your Medicare HMO or PPO plan, they could take that away year by year. It's just an extra benefit. It's not promised. So if you want to buy full dental, talk to your dentist to make sure what plans they're in, and you can get full dental coverage. Number two, Medicare does cover, of course, cancer and heart attacks and strokes, these critical events. But oftentimes you have a lot of extra spending around that event that Medicare doesn't cover. Maybe you have to rebuild your bathroom or your bathtub. Maybe you can't, use the same bed or something like that. So you can buy extra coverage from insurance companies that'll help you with those critical events. If you have AFLAC, for example, they offer some things that, and I could tell you all about those different plans. Medicare on number three, Medicare doesn't cover life insurance. It doesn't cover to bury you. I've had that question to say, well, does Medicare bury my mother? No, it doesn't. It's not its job. You have to have your own insurance for burial or your own money for that. Home care. Medicare doesn't cover home care to have somebody come and cook and clean at your home. A very small percentage, 1% or so of Medicare Advantage plans do have a little tiny bit of benefit. But if you want to have home care assistance, you need to have a long-term care insurance policy. That pays for people to come take care of you at your home or pays for an assisted living facility. Medicare only pays for 20 free days of skilled nursing care at a rehab facility while you're recovering from a surgery or a stroke or something, plus another 80 days where you have to pay for them. That's 100 days total. Very infrequently that people get even the 20 days. So if you need to have peace of mind to have all of your skilled nursing care, your rehabilitative care, your custodial care covered, you want to have a long-term care insurance policy. Or you can have some veterans benefits. If you're a veteran from wartime, you can have aid and attendance benefits, up to $2,100 for the veteran, up to $1,400 or so for the spouse. That's free money from the government, from the Veterans Administration. Or you're going to need to sell your beach house, or you're going to need to have your own savings account to cover that care, which can get expensive. Medicare does not cover it. So let's recap. There's two ways to access Medicare, through an Advantage plan or through a Medicare supplement. Half of people at age 65 are doing one way and half are doing the other way. And your decision is not permanent. Every year, I move people from each system to the other system and back and forth. I do it all the time. There are rules, and it's not perfect rules because it's the government. And sometimes the state rules and the federal rules don't quite match, but we can make it work in most situations. Medicare doesn't cover everything. We already talked about dental and vision and hearing aids. You need to review your plan. You don't want to set it and forget it. You want to review and manage your plan. You can get help from us for free. We'll help you from October 15th to December 7th each year. And the dual people that have Medicare and Medicaid or chronic illnesses or just low income also, they get special plans and they get special privileges. If somebody becomes low income in the middle of the year, I can manage their Medicare when their income changes, such as having a spouse die. So what are your steps? You want to always give yourself about 3 months ahead of time before your retirement date or before your 65th birthday and start doing this process, because it takes about a month for Medicare to activate your Medicare benefits through their government bureaucracy. That gives you another 2 months then out of the 3 to shop and to find the right plan that your dentist and doctor and pharmacist use. And then when you turn 65 or you retire, you're ready to go. And then remember, on October 15th is when you do your coverage review each year. Not a big deal. It's just a process. And we help you with that process. We'll teach you how to avoid bureaucratic obstacles. So let's talk about Medicare and the coronavirus. What does Medicare cover? This was amazing how fast Medicare increased their benefits in March. You know, the first, my office had to shut down on March 16th because we thought we had some positive cases and probably did. The testing was really poor back then. It took a week to get back a negative test, and it was probably a poor test. But the government fixed on Medicare for Medicare on March 1st that the lab tests for COVID-19 were free. You pay nothing for them. And now we have antibody tests. The antibody tests aren't that great, but the antibody tests to tell you if you've had COVID, those are free also, as long as they're FDA authorized. There's a lot of really poor, junky tests out there that aren't authorized. And then all medically necessary hospitalizations for COVID are covered, of course. But even some of the plans said, hey, normally we're going to charge you, maybe $200 or $300 a day to go to the hospital, and we're going to waive that charge if it's a COVID hospitalization. They didn't want people to stay at home afraid, of getting treatment, so they waived the copay. That wasn't required, but that's something that happened very quickly. And if you had to stay in the hospital longer, because back in April, May, and June, it was kind of hard to find a place to put people after they were in the hospital. Where do they go afterwards to recuperate? So the government made some special rules about that too. Now we're getting ready to, it was just announced, we're getting ready to get a vaccine probably for high-risk people by the end of the year, for normal people like myself, probably by April or May of next year, for seniors probably in January, February, March. A vaccine, the first one's from Pfizer. AstraZeneca has got another one that'll be coming out, as well as Moderna. We might end up with 3 or 4 good vaccines, and some of them are going to be 1 shot. The Pfizer vaccine is 2 shots over 7 days, and it's 90% effective is what they say. It's incredibly effective. A lot of times the flu vaccine is only 30 to 50% effective. So if we get 90% effective, that's incredible. I'll be ready to get back on a cruise ship, if that's the case, go to a concert or something, right? So those vaccines will be free when they come out. Medicare has already said as long as they're FDA authorized. So here's the next thing, is that, if I can get to it, I'm sorry, is that the Medicare insurance carriers also did their own responses. A lot of them went back to March 1st and said, we're going to waive the cost for going to the doctor, for doing telehealth, for talking to your specialist, to talk to your mental health doctor, behavioral health. We're just going to waive those costs, the copays. And they did. Pretty incredible. And they also rebated people that had already spent the copays. A lot of them went and reprocessed the claims and sent people checks back in the mail. That was cool. And then some of the plans, can't tell you the name, but some of the plans actually sent out face masks. 2 of the major insurers. I think every insurance company should have done this. The easiest thing in the world is to send your people a face mask. And they were sending 2 of them so you can wash one and wear one. Brilliant. That's not rocket science. Send everybody a face mask and then put your logo on the front and they'll advertise for you. That's even better. I've made some face masks for my own staff that have my logo from my company on it. A lot of the Medicare supplement companies, two major ones, have assured us that the pricing was going to be stable for both new and renewal plans. If you know somebody that just got a big rate increase on their Medicare supplement, they need to shop it because they shouldn't have gotten a big rate increase. This shouldn't have been the year that people got a 10 or 12% rate increase. They need to call me because they're getting overcharged. Also, the government approved special relaxation of the enrollment rules to help us during the middle of the epidemic. And it looks like, I mean, it is for sure right now, we are going into an exponential growth. If you've not watched the news over the last couple of days, we had 140,000 cases yesterday. 2 months ago, we had 34,000 cases. So we've gone up 100,000, by almost a factor of 5. And our deaths have almost tripled in that time period. So the government might give us some additional relaxation of the rules to help people in case they can't get to doing their Medicare reviews. They do this when we have hurricanes. If somebody's affected by a hurricane in the middle of the Medicare enrollment, we get special relaxation of the rules. So pay very close attention to the news right now because it is getting crazy on the number of infections happening right now. My dad's 83, my mom's 80. I've already warned them today. So warn your friends. Don't be a fear monger, but be very, very serious that this is not over yet. So here is our name. It's Affordable Medicare Solutions. The address, we're in Suwanee, Georgia. You can call me. The information is in the chat box. Our number is 770-945-5261. Our website is amsplans.com. And our YouTube channel with all of these recordings, as well as the high income penalty recordings and how do you review your drug plan, all of those things are in our YouTube channel. So you can watch videos whenever you feel like it. And some of them are 10 minutes long, some of them are longer. I've hosted most of them. Please let your friends know that all of our services are free. There are no charges for everything that we do. We do all of our education classes for free. If you have a church or another group that you're a member of, a Kiwanis or Rotary or something, and you want to have a speaker on this topic, I will do it for free. In person when allowed, mostly by Zoom these days, of course. Right now is the time of year for you to do the annual review for your Medicare. What does that mean? Check your drugs, make sure they're covered, make sure you're not getting ripped off. Talk with your doctor. Make sure your doctor is not going to pull a fast one and pull out a Medicare on you, because you want to find out before the other 1,000 patients are looking for a new doctor too. Find out, make sure that your Medicare plan covers what you need next year. If you need hearing aids, sign up for the option that has hearing aids. Sometimes you don't even have to change the company you're with. You just have to change from option A to option B, and then they give you some more benefits. It's amazing. In Gwinnett County, under the HMO and PPO options, there's 51 options, 5-1. It's ridiculous almost that there's so many options, but some of them hardly cover anything, and some of them cover the moon. It is not a hard thing to do a review. If you call my office right now, though, you won't get an appointment for tomorrow. It'll probably be in a week or two. We'll fit you in if we have to do it at night or on the weekends. We'll get everybody in before December 7th. So please give us a call. All of our services are free. I want to say thank you again to Sandra Norrid. She's always been a wonderful friend and supporter, and love to see you guys again at the library in Forsyth County. Maybe next year. Maybe we'll get our vaccines and we'll all be able to get together as friends again. So thank you very much. Do we have any other questions? Sandra has a note for me to remind everybody that some of the plans offer reimbursement for dental and vision, which means that they'll reimburse you for your expenses. Some of the plans don't offer that, and some of the plans require you to use certain eye places, certain dentists, certain hearing aid places. So your plan might have a reimbursement, while your neighbor's plan might have a program that you go utilize to get your free stuff. So each plan is allowed to set up their design separately. And some plans, provide you with transportation, and some plans don't. It depends on the program. So thank you very much. Have a great day, and I hope you found something today useful and it'll save you money.